Hi, I'm Martha Pantages, and I'm a PA at Fountain of UMD, and today I'm going to show you how to do a weight loss injection on yourself. When your provider prescribes you your Semaglutide or Tirzepatide, what we'll send in that prescription to our pharmacy, and you'll receive a tracking number via email to know when to expect your prescription to arrive. In that box, you'll have both the vial as well as some alcohol wipes and syringes. The vial does need to remain refrigerated, so you can make sure you put that in the fridge. Take your alcohol wipes and syringes out, keep them to the side. When drawing up your medication from the vial, be sure to take the vial out of your box. On the box, it will have your recommended dosage and your instructions there. The vial will have this cap, so you can pop it off, or even peel off this metal part if you need to. And there's a bullseye here. So what you'll want to do when you are injecting, you take one of your alcohol wipes, wipe on the center here, this little gray bullseye, just keep it nice and clean. Now, with your syringe, it's an insulin syringe, and what you'll do, you take off this end cap. So you'll take out the end cap, you can put that in the trash, that's fine. This top part is where the needle is. The needle is pretty delicate, it can bend very easily, so be very careful with this. And depending on your dose, you draw up your needle to, say, in this case, 20 units. So you'll see the 20 on the syringe. Keep that air in, go ahead, and you want to aim for the bullseye. What you'll do, flip it upside down once it's in, push the air in, and sometimes there will be a vacuum component to it that will bring out that medication right to your dose. Sometimes you do need to pull, that's fine. So the goal is to get the top of your plunger here, this top black part, to your recommended dose. Now that we're here at the 20 in this case, what we'll do is gently take the syringe out and the needle, because again, the needle can be very flimsy, can break and bend. We don't want that to happen. What you'll do, recap it and set it aside, but get yourself ready to inject. So when injecting yourself, it's important to find the right location. So for me, if I'm injecting myself, I like to aim for an inch or two below my belly button and an inch or two on either side. I personally prefer to switch up the side each week, but it's ultimately up to you. So when I locate the spot where I want to inject, I take my alcohol wipe, and I want to make sure I clean this whole area. Even though I'm not injecting this whole area, I want to make sure this whole area is covered, because Lord knows I may not be able to remember the exact spot that I wiped with my alcohol. So I just clean that whole area, and then put that aside, and then pinch an inch. That's a cutesy way of saying it, but we want to make sure that there's enough subcutaneous tissue or fat that we can make for a good injection. So with pinching an inch, you're going to be ready to inject. Now in this case, I'm not injecting myself, so this is remaining capped, but for you, you will have an uncapped syringe. So keeping that pinching an inch, you take your syringe, a 45-degree angle, you insert the syringe, and then you push gently and just steadily. You don't want to push too fast, because that can cause a knot. It's a redness that can turn into a bruise. So just a steady push, and you're done. At this point, congratulations, you've done your first injection. What you'll do is you'll recap that needle, and then what you can do is actually collect your needle in an empty plastic bottle, whether it's a laundry detergent bottle or a water bottle. You can just drop those in there. We want to make sure that your sharps stay protected. We don't want them to accidentally prick anyone, so just for safety wise, put it in there, and then you can either bring it to your local pharmacy or you can bring it to us to dispose of.